Thank you very much. It's interesting, in all these years of working with the states, that point about how times of turmoil and conflict can be good for change. While I thought about it in other contexts, I never really thought it in these words here. When I worked in the U.S. Department of Health and Human Services, and I was very worried one day about a conflict, about a program I cared about, and somebody said to me, you know, people go to the movies for the conflicts, meaning times of conflict elevate the attention, the conversation, and they unstick where things were before. So I'm now going to ask a few questions of the panel, and then soon turn it over to you in the audience and to those on the web. I'm sure we're printing out web questions, and I'll have some of them soon. I don't know if we have any of them yet, but feel free to jot them down. And for those of you in the room, start making your notes about what to ask. So I think my first question is going to pick up on one of Bob's points about challenges ahead. He talked about the political environment, and I just want to ask people on the panel, we have one state, North Carolina, where the project has remained important through a change in gubernatorial administration, a change of parties, other states with governors and legislatures of both parties, and I wonder if people can say a little bit about what makes it appealing in your context, what makes it appealing across party lines, and what are the political challenges you encounter? Maybe a little bit about how you talk with legislators or with the public about these programs. Does anybody want to start? Sherry, did you want to start?
I'll start. Because yes, this has for us transcended across actually 3 administrations, if you take it back to when we first started planning our IT. Lots of challenges and opportunities. I think the one thing that keeps us focused is the fact that the tenets of what we're trying to achieve are universal, they're bipartisan, and when we started down this path, talking about families and talking about children. We weren't talking about policies and processes. We weren't talking about our agencies. We were talking about the individuals that we serve every day. And I think one of the things that I'm most proud of is those tenets have stood the test of time. They stood the test of time through some very bumpy IT implementations. They stood the test of time through conversations about budgets and personnel and administration. And just so that you have some understanding of what I mean when I talk about our tenets. Our tenets are not written bureaucratically. They're not written with jargon about people, except for our families. And it's basic. Families will tell their story once and receive the services that they need. That's the first and foremost. Mm-hmm. And no matter who you are, where you sit, or what agency you sit with, or what side of the aisle you sit on, if a family has a need, it's government's responsibility to deliver that benefit and assure the safety and security for that family and for those children. And we all want to see that. And we keep that in the forefront of our decision making, of how we work with each other across our programs, and how we interact with our counties who are administering these services.
So Reggie, did you want to comment? Or
I was thinking as Sherry was speaking, Colorado's experience was very similar. This is a bipartisan issue. Colorado, again, a local controlled state. We're made up of locally elected county commissioners who are partisan, Republicans and Democrats. Turns out one thing they have in common at the local level is they don't want people standing in their lobbies waiting for services to which their citizens are entitled to. The computer system I talked about not working cut across partisan aisles. Colorado is also pretty unique. We were the only state in the country that had bipartisan support to establish our healthcare exchange. Came through a Republican-controlled House, was approved by a Democrat-controlled Senate, and signed into law by a Democrat governor. And so this is an issue that cuts across both parties in our state. It cuts across local, state, and federal levels of government and brings us an opportunity to put aside partisanship and work together. The other thing I was thinking about when you mentioned interest groups, and I know Washington interest groups might be different than Colorado interest groups, but one of the things that we did was to engage interest groups who used to be the people banging on the door to get government to change, to say, you know what, Hunger-Free Task Force, why don't we give you opportunities to sign people up for benefits in your food banks and other locations rather than taking time and energy to come and bang on the doors? And they became a part of the solution, and their advocacy shifted from being the adversary to being the partner, which has been really critical to the success of Coloradans.
So I want to pull a couple of points out from that and then see if there's anybody else who wants to comment. Some of it is probably special to these particular states. I mean, Colorado is probably not typical, as you said, in having the ACA expansion be nonpartisan. But the theme I hear over and over is the theme that having long lines and unresponsive and bureaucratic government service delivery isn't popular with anybody. So that in some ways, that piece of it, I think people have been very successful at addressing with both county and state officials of both parties. Do you want to comment?
Yeah, I do. Olivia. Thank you. And for us in Rhode Island, we talked about the business process re-engineering, and what was so significant for us is our workers, and I look at the team there who worked so hard, are now administering eligibility for all programs. We made that shift. And I think as we transition into a new administration and for service delivery, that's something we've worked so hard on. I really don't see that going backwards. So I think from the bottom up, that change has been shifted, and that's going to be very difficult to undo. But I also agree with what everyone said. It's going to be very hard to not understand the increased efficiencies and the better services to our clients. So I'm optimistic that we'll just keep going.
So I want to ask something else from slightly a different angle, which is also, as Bob said, there have been accomplishments. There are clearly also remaining challenges, as everybody was honest about. And I think one of the things that everybody here has been willing to do is try some things that didn't work. And everyone here is very honest about that in private, so I'm going to see if people can think of something you tried that didn't work or didn't work the way you thought it was going to work, that nonetheless you learned from, and it was a good thing in the end. Because I think one of people's criticisms of government is it can't innovate because no one's ever willing to take a risk. So I wonder if anyone has an example you could give of a risk or an experiment that didn't work as you thought it was going to work.
Well, I would say in South Carolina, we tried to put together a joint application because, again, we are two separate agencies, and it's something we worked on really hard, and we realized that, you know what, perhaps we need to improve our communication and collaboration and processes as we're trying to streamline service delivery for our clients. So what we decided, we didn't give up on that joint application, but what we have done is we're going to, attack, I guess, the project in a different way using the lessons that we've currently learned on collaboration and what our clients need in our state.
So you tried something, it wasn't the right moment for it, it was too hard, and you learned from that to step back and try something else. Jen?
When we first started the business process reengineering efforts, we gave a lot of local control. We worked with the staff in the local offices and allowed each office to kind of come up with their own type of system. And that was very informative. We tested a lot from that. And then when we rolled out our new eligibility system, we also let the offices select whether they wanted to be task-based, caseload-based, or some hybrid. And we had 80 offices, and we probably had 95 or so different business processes happening. And that was not successful. It made the system much more complicated than it needed to be, because by trying to accommodate every business model, we lost a lot of the advantages that would have been brought from the system if we had gone with one. And we also realized that a lot of the local offices didn't necessarily want to come up with their own system and make all these choices and design something. They looked to us and said, what works? Tell us what works and how to do it, and we'll go do it. We don't have time to test and be all innovative. So we are shifting to more of a standardized set of processes throughout the offices, and we'll let you know in a few months if that works or not, but what we tried before didn't work, so now it's time for the next iteration.
Can you just say a little bit more about what it's like in a state leadership role to try things in that kind of an experimental way and then, move away from them and try something else? That's a hard thing to do in the public sector. People can criticize or see it as waffling. How did you do that?
I think it's better to take the criticism from changing and walking away from something that didn't work than to stick with something that wasn't working for the sake of not changing and being hard-headed about it. I mean, I think we phrase this whole thing as pilots and as learning and as trying different things, and because we worked very closely with the staff on the ground. And they were the ones who gave us a lot of information about what was working and what didn't. So I think it would have been worse if they were giving us feedback and we, stubbornly stuck with something than what we did, where we brought a group together from across the state and said, okay, let's sit down, let's figure out standardized processes that will work. And people have really kind of rolled with that because, again, they're the ones on the ground, they're seeing what is working and what's not working. So they're hungry for, more successful processes.
Any examples over here? Reggie?
A couple of things come to mind for me. In Colorado, we have similar issues being a state-supervised, county-administered system, 64 counties. And we've had a fairly flexible approach to how counties may choose to set up their own eligibility processes. Rather than doing a statewide business process reengineering, we've done it county by county by county. There's some strengths to that because there are lessons learned that you get from some counties, but there are lessons learned you get from all counties. Some of them are lessons that you want not to replicate again. But other lessons are really innovative ideas that you might not have tried if you had done it one way. At the same time, we're also struggling with, well, if a county is getting exceptional performance and another county is not, how long do you allow that other county to create their own way of doing things before you roll out standardization? And so we're really struggling with where to come down on that issue. The other thing that I was going to mention, and I'm almost embarrassed to say it because it sounds so basic, but when we went into timeliness and did all of these changes with the computer system and business process reengineering and a variety of other changes, my assumption was that if we put these new processes in place, we would improve timeliness as well as accuracy. And what we learned was, yes, we increased timeliness, but we didn't improve accuracy. As a matter of fact, in some of our programs, accuracy went backwards. And if I could go back 4 years ago, I would put timeliness and accuracy as equal components and make certain that we were fixing both at the same time rather than assuming that one would fix the other.
And so you're discovering you have to work on both of them together in order
Exactly.
to get better. Sherry, go ahead, and then I'll ask one more last question before going on.
And just to pick up on the notion of communication, don't assume because you're using the same words that you're saying the same thing. Yes. There were lots of times where we had to just stop and pause and take a deep dive and have just conversations about 2 words, learning curve, or universal, or just don't underestimate what people are thinking and create opportunities that are safe to have conversations so that you really understand where all the partners and stakeholders at the table are coming from.
So let me just ask the same kind of thing I asked Jen, Sherry. How do you actually create a safe environment to have those conversations in a public agency where probably everybody you're dealing with, somebody works for somebody else and thinks they're going to be in trouble? Can you give us any flavor of how you do that?
I think it goes back to trust and transparency. You've got to tell the whole story, the good, the bad, and the ugly, and you've got to listen to the good, the bad, and the ugly. And you got to invite people to the table to help you solve your problems and solve your issues as they come up.
Yes.
So, well, I'll ask one more thing. I'm going to invite people in a second. Are we going to have people, I guess we're going to have people line up at the mic, so maybe start doing that while I ask one more question. We've talked a lot about 2 of the programs in the Work Support Strategies package, health insurance and nutritional assistance. We haven't yet talked as much about child care assistance, which obviously is crucial to working families. It's in a different financial place than the others. My colleague Hannah Matthews at CLASP just has a great paper out that's on the CLASP website that says, sadly, we're down to the lowest number of children receiving child care assistance in a dozen years, so the federal money is not in the same situation as the others. Nonetheless, a number of states identified important ways to do some of the same things, help families who are eligible not jump through as many hoops. And I wonder, I know Deb might want to say some things on behalf of Rhode Island. A couple other people might want to comment.
Thank you, Olivia. Yes, we've taken advantage of the policy assistance on the child care side, and we looked at the policy alignments and also in the beginning, our requirements for documentation, very significant, document work schedules, et cetera, et cetera. So it's not to say that we are sacrificing program integrity issues, but we're looking for other ways to get the verification to make it easier and allow our recipients to get the child care that they need. So we've worked quite a bit on alignment of policy, aligning recertification, looking at the seasonal prospective budgeting, and we've looked at Equifax as an access to income, income verify online, over the internet. Are they working? What's the income? To try to reduce the barriers to child
So
care.
you looked in a very fine-tuned way at what are the things that are holding people up, keeping them from getting benefits, and then you tried to fix
Yes.
each one of those.
Yes.
Sherry, did you want to comment?
Yeah.
And Jen wants to.
Sure. I think our conversations go all the way back to our policy alignment work. It's very true that we're not getting a lot of new money. And in North Carolina, we braid lots of different funding streams in order to increase access to child care. We use a portion of our social services block grant, our TANF dollars, our child development block grant funding. There are a lot of state dollars that go into the administration of child care. And we know that there are not going to be lots of new opportunities for funding, but yet we want to see more children having access to quality child care. So to the extent that we can decrease the administration of many of these programs, use information across program lines. If a family's already getting SNAP, then to be for sure they're eligible for child care. Let's not repeat the process, repeat the requirements of administration. Let's use those administrative dollars to increase access to child care. And that is the impetus of where we're trying to come from to really work across these program areas to reduce the administration across the board.
Okay. Jen, you want the last word on this topic, and then we'll go to the audience for questions.
I think the challenges in childcare are very similar to what the challenges are in SNAP and medical. But as far as program alignment, there's a lot of low-hanging fruit. There's a lot of opportunities to improve because at least in Illinois, we hadn't really looked at them together prior to this project. We have grand visions of doing data matches and sending out letters and encouraging people who are enrolled in one, not the other, to apply. But on a basic level, we're rolling out new eligibility systems for both programs. Let's make sure that they can talk or that we have cross-access to them. Where are opportunities that if something is verified in one program, the other program can use it, and to continue that eligibility based on the information in the other thing. So there's a lot of work to do on it, but this project has really kind of started the conversations and helped us looked at it in the framework of these are working families, what can we do to support them and get them the full package?
Thank you very much. So I've gotten a couple questions from the web, and also a note that the webcast is having technical difficulties which we're trying to fix, so I apologize to those on the web, but let me go next to a question here in the room. If you can identify yourself and ask the question crisply, and we'll get a couple answers in.
Hi, I'm Jeff Hayes from the Institute for Women's Policy Research. I have a question primarily for Rhode Island. I was wondering how you've been integrating your new paid family leave program, temporary caregiver insurance, into these other programs, and whether you see interactions between that one and the programs we've been discussing in more depth.
So I'm sorry, I didn't get the whole thing.
Your paid family leave, the temporary caregiver insurance, is that being integrated with
Okay.
these other programs, or are you seeing interactions with it as it starts to be implemented?
I apologize, I am not familiar with that.
So the paid leave program is what you're asking about?
Insurance?
So Rhode Island is one of three states
One of three
that
states
have
that
paid
started in
family leave.
January, right.
Right, operated through the
It's
insurance.
TDI, TCI.
Right, operated through the
Okay.
unemployment insurance
Right.
opportunity.
So it's out of a
that's an
completely different
interesting
department,
future.
that's why I was wondering, right.
Yeah.
Right, no, it's an
A
interesting
very
future
good
set of
question, I'm
questions.
sorry, I'm not familiar with that.
But one that sounds worth thinking about.
Absolutely.
Go over here.
Hi, I'm Cynthia Woodside with the American Public Human Services Association, and of course, we're very proud of all our members who are doing such great stuff. And I wanted to take this opportunity to kind of tap into your brains and your experience for a minute. And Jen, you started talking about this. I mean, I'm wondering with the enactment of the Workforce Innovation and Opportunity Act, and the plan and the desire to start integrating, coordinating, work and employment programs, across the state, whether or not the experience that you've had with this project and other programs could really serve as the basis for doing more integration in that area and bringing in the human services piece to the workforce programs, or whether or not you think that it's a separate entity would be more problematic than what you've done so far, would, smooth the way.
Okay, a topic that lots of my colleagues at CLASP have lots of opinions on too, but let me go to the state leaders here. Anybody want to comment on the opportunity to connect to the workforce system, job training, given that there's new legislation there? Reggie, then Deb, and I'll get anybody else in who
So
wants.
thank you, Cynthia, another one of the great APHSA staff. Glad that you're here. First of all, the federal law is a brand-new federal law, and so at least in Colorado, and I would guess that my state colleagues share this, we're all still sort of absorbing it. What does it mean? How do we interpret it? And what do we do about it? We're in the very early stages of having those conversations. But I will say this, in terms of my belief, turns out when I'm not here, I'm a dad of 3 kids. My wife works full-time as well, and work is very, very important to us. But we don't think about work as being all-encompassing in everything in our lives. And as a working parent, I think a lot about my children's needs. I guess where I'm going with that is to say, we ought to be careful not to think that because there's this new federal law that says all work should be connected to one another, that it doesn't take all of state government to understand the whole of kids, families, including especially working families, and that all of us need to surround them from their perspective and support them in the work that they do. Some of you might know I'm a 2-generation fellow with the Aspen Institute, and we believe very strongly in making certain that we have the right economic support, but that it's also tied to early childhood opportunities, early learning opportunities. And that isn't just one state agency or one federal program. That's all of us figuring all of that out together to make sure that working families are best prepared to be successful.
So I'm going to say one quick thing, and then I think there was someone else. Deb, was it you who also wanted to comment? It was Sherry. Okay. The new workforce legislation, it's again an example of Bob's point that maybe when things are changed, there's an opportunity to make big change. It includes provisions that are intended to make post-secondary education and training services much more accessible to low-skilled workers, which is often who my colleagues here see. And CLASP is planning, has already done some writing, is planning a lot more on that. And my perspective, which I'll be interested in how people see it, is there's always a balancing act when you're trying to connect up programs in an effective way. You have to set priorities, because if you try to do everything, you'll fail. But you have to have a big vision and use the lessons. If we've succeeded this far, how do we make that next connection? So I think it will be really interesting to hear how people want to use some of the lessons they've had as they look forward. Was Sherry who wanted to comment?
Yep.
Did you want to?
And I was just going to say, a wonderful opportunity, and we're beginning to see it and have been seeing it for quite some time. As a person that is very familiar with the Work First program and now learning more in my new role about vocational rehab and services for the blind and senior employment programs, getting lots of feedback from employers in the community about the need for a better, stronger, more coordinated system in coordinating with them, because they're reaching out and are very interested in employing individuals that we're working with, but we're knocking on their door in many different ways, coming from many different sides of the house in terms of programs and services. So I think the same kind of coordinated effort about wrapping services around the individuals and giving individuals the opportunity to keep those services in place for the duration of time for which they're eligible is sort of a no wrong door approach for those that are seeking employment as well. Because I know at least in our system, you're likely to get what you get because of the door that you walk through. So if you walk through a TANF door, TANF is more likely to serve you. If you walk through a vocational rehab door, then vocational rehab is going to try to serve you. And oftentimes those doors or that opportunity needs to transcend and be decided more from an assessment of what's best for that individual, not necessarily based on the door that they walk through. So I think there's a huge opportunity there.
I'm going to go to the microphone, and then I'm going to do a question from the web. Go ahead.
Great, thank you. I'm Josh Protas from Mazon, a Jewish Response to Hunger. And I know that there are many other folks here in the room today from other nonprofit and charitable groups. So I was wondering if the panelists could speak a little bit about how they have engaged and included nonprofit organizations in the process for the different state efforts and opportunities to expand that as well.
Great. Anybody want? I'm actually going to make one comment and then go to anybody who wants, which is that it seems to me that one of the things people have learned about the ways that don't work to include nonprofit and charitable groups is to have them work on bringing people in at the front end while the back end is still all messed up. So one of the lessons has been about how to fix in ways that make it possible to serve families effectively throughout. But I think there's a lot of different ideas here. Jen?
We work very closely with advocacy organizations in Illinois and nationally through a Social Services Advisory Council. It's actually mandated by state law, but we meet regularly and have subcommittees that focus on issues like cash, SNAP, and medical in the local offices. And we have had tremendous success by keeping them very closely in the conversation, keeping them informed of what's happening at every step of the way. And I think through those conversations, they've got a good understanding that we're trying to do something big. We're trying to replace our system. We're trying to really improve the benefit delivery system for the residents of Illinois. And because of that, they've cut us some slack when we've hit bumps along the road. So because we've let them know what we're doing every step of the way, when we developed a backlog because of the Affordable Care Act, they understood. When we developed a SNAP backlog associated with that, they didn't jump right to the courts to sue us. They actually supported us trying to buy some more time from FNS, from Food and Nutrition Services, when they pressured us a little bit. And that has really helped a lot. And they've also got a fantastic perspective. When we were talking about the delays, one of the advocates actually said, I worked in the 1980s a lot on Medicaid applications, and I represented so many people who could only get health insurance if they proved that they were disabled, and many people struggled with that. If somebody had told me in the 1980s that we will eventually provide health insurance to everybody, but they might have to wait 4 months to get that, I would have said, oh my God, sign me up. They were so excited about it. So when they've got a perspective like that and they're able to keep the bigger picture in mind and really know that we're all on the same page, what we're trying to accomplish, then they're going to be with us through the challenges that are along the way.
They were telling you 4 months wasn't okay if it stayed that, right?
Right, because we're making progress, yeah. So they walk the fine line between understanding but keeping the pressure on us, but that actually can be helpful when we're asking for more resources or something to have that partnership.
Anybody else want to add? Deb?
So in Rhode Island, just like Jen mentioned in Illinois, we're very committed to the advocacy, our community partners, and we've had many advisory groups, and we participate. And just like Jen, familiar with work support strategies and the changes that we've been trying to make. And to bring it a step further, we also bring in some of our advocacy community to test our online application. So as we've been moving through the creation of the eligibility system, we've had the advocates come in and our community stakeholders come in, experiment, sit down before the technology is done. So they've been very, very valuable partners in making sure that our applications look good, are accessible, and so on. So they have been wonderful partners.
Short comment, Reggie, then
Sure,
I'm going to do a web question and then one more.
In Colorado, as I said earlier, our nonprofits have been important partners, not only in many of the ways that you heard about in Illinois and Rhode Island, but also saying to them, because Peak is online, it's available online, put a computer terminal in your office. When you have clients who are in your office, get them to sit down and help them with the eligibility, with the application process, excuse me. We also are engaging them to better understand so that clients that they're working with who are applying have the right forms in the right way at the right time, which only smooths out the process for the client and for our county partners in getting that application done timely. And our nonprofit partners have really been amazing at stepping up and helping us to do that. And lastly, on the Medicaid side, many of the nonprofit partners have become, I'm not going to get the term right, Medicaid navigators? Did I say it right?
Yes.
Nice. Healthcare policy is in the room, so I'm a little sensitive about talking about their programs, but also another opportunity to be a part of the solution. You know who the individuals are who are eligible, who would benefit from these programs. Let us empower you by giving you the tools that you need to help them get these programs the right way at the right time as they identify what's right for them.
Great. So I'm going to ask one web question, get a couple quick answers, get one question in the room, and then I'm going to give people a very quick last word and end with Bob for his reflections. So the question from the web takes us back to childcare and says, given the volume and the issues when you cross-train eligibility workers to know a lot of programs, how do your agencies address parent education and the importance of quality? That is, if we're focusing on making sure that low-income working parents can get the whole package, how do we also focus on ensuring that kids are in quality programs? And I know that's a very big question, and I would say from my own perspective that it's that figuring out how to connect on both levels is something many states are in the middle of, but I suspect there are some early lessons, maybe from Reggie, or Deb has some comments too, Sherry might, Jen might. So why don't we get a couple quick comments on that one? Do you want to start, Deb?
I will. I'll be real quick. I'm just thinking race to the top, and I'm looking at Deb Anthus, and so Rhode Island is very immersed in race to the top, and we are doing so much with quality rating. Bright Stars incorporating it into our rules. So fortunately, the combination of the work support strategies, race to the top, childcare, we've been working very hard at the quality issue, actually incorporating it into the rules, et cetera, et cetera.
So you're finding that having stabilized childcare a little bit by making it not, making families be able to keep it longer is helping you link it up to the race to the top work.
Yes.
That's great.
Yes.
That's great to hear. Reggie, did you want to add anything?
Similar in Colorado, but look, here's the issue. Childcare started as a formalized process back during World War II, right, when women for the first time in our country's history went aggressively into the workplace. And it's been a critical work support for 80 years in our country. Go back about 50 years ago, we started to research and understand that children, particularly kids from low-income families who have high-quality childcare experiences, are more prepared for school, all kinds of benefits. I won't begin the lecture on all of that. What we now need to understand in the 21st century is that childcare needs to be both a work support and an early learning strategy. We need to move beyond picking one or the other as being the primary objective, and we need to share both goals. And that's what we're doing in Colorado with combining Race to the Top, Early Learning Challenge Grant funds, and priorities with work support strategies. And our goal is to help more Colorado kids from low-income families have access to high-quality childcare. We're at about 21% currently of kids in child care assistance program in a 3, 4, or 5-star facility. Our goal is by the end of June to be at over 30%. And our goal is going to be even higher. It's about helping child care providers to be successful. It's about making sure that we have the right resources to fund high-quality child care. And it's also about helping parents be better consumers about child care, understand why it's important, and help them to get access to high-quality child care in their neighborhood.
Well, there's obviously lots more to say about this particular question, but I think that's a start on where we might go with it. And let's take one more question.
Lisa Hamler-Fugit from the Ohio Association of Food Banks, and I want to thank each of the funders that have made this collaboration possible, and to all of the states for your risk-taking and your very frank statements about your successes, as well as some challenges that you face. This is really looking forward as we talk about these being work support programs, and would encourage the Work Supports Initiative to really look at the next steps of education, training, and what it looks like to help low-income families build their human capital and move up into the economic mainstream. This is a question for the panelists whose states have expanded Medicaid. Are there any thoughts or processes happening in your states now to transition Medicaid recipients into the marketplace?
Meaning people are not quite sure what the question means. So people in the expanded Medicaid.
In the expanded Medicaid, when their incomes increase, do you have plans as far as a seamless or as close to a seamless transition to move these beneficiaries into the private marketplace?
I see. So the question is, if people have worked on connecting horizontally, making sure that you're getting the whole package of supports, what about vertically? What about as your income changes? And I don't know that people here will give the technical answer, but I suspect that the answer is you've got a lot of strategies for doing it. Does anybody want to comment?
I can just say.
Yeah.
We already do that in Illinois for applications, that we do have a no wrong door approach as mandated, that if somebody comes in and applies for Medicaid in our system and they're found to be too high of income, we do refer them to the marketplace. And we will be doing that for cancellations as well. Right now, our active cases are still in our legacy system, so the connection isn't there yet, but we are working on building that and trying to create as seamless as possible of an integration with the marketplace.